on, and we're live.
Okay. Good morning, everyone. Thank you so much for being here with us today. I just want to begin by sharing that this is the Arizona Commission for the Deaf and the Hard of Hearing Quarterly Task Force meeting. And my name is Christy Abrams. I'm the Hard of Hearing Specialist here at the Commission. Our meetings are fully accessible. We do have communication, access, real-time translation, otherwise known as CART or captioning. And this is the gold standard for people that are hard of hearing to have access to meetings. We also have American Sign Language or ASL interpreters with us today so that we can welcome our deaf community and our hard of hearing community. So, and our meetings are live streamed to YouTube, and we welcome the public to attend. And towards the end of our meeting, we will have time for comments and announcements and questions. Okay, and I want to go ahead and do a roll call for our task members today. And once I call your name, if you could please just say here or present. And once you do that, feel free to mute your microphone and turn off your camera. So Liz Booth.
Present.
And Ron Tallman.
Here.
Cynthia Ammerman.
Here.
Barry Forrest.
Here. And I would just like to add that this techie dude found what Ron was trying to describe. I have captioning now, but it was not located on the laptop where you mentioned it. Instead, on the top right-hand corner, there's a button that says more. I hit that more button, and I now have, and see, one of the prompts came up for CC. I hit that, and I do have captioning now. So thank you very much.
That's wonderful. Thank you, Barry. And thanks for describing that, because sometimes screens do look differently. So, okay. And Commissioner Fred Williams.
Here.
And Commissioner Melanie O'Rourke.
Here.
And Roz Siebold.
Present.
Okay. And we also have team members here with us this morning. We have Michelle Michaels. Present. And Spencer Brown, who I'll be introducing shortly, is here with us today. Okay,
Here.
wonderful. Let me just look here at my agenda. What I would like to start with, and what we can do too, is we can turn off our cameras and our microphone, and that way it'll make it easier for us, the community, to see and have access to the screen. So I'm going to, since Spencer is with us this morning, I would like to begin by introducing Spencer. Spencer, I'm going to have you pop back on with your camera. I would like to welcome you to our meeting this morning. This is Spencer Brown, and he is our brand new communications and media specialist. Do I have that correct, Spencer? And
Yes.
We would love to just welcome you. And I'd love to take a moment for any new team members. We've had a lot of new people join the team, and we want to, if you could just tell us a little bit about your background and your new position with the commission.
Of course, it's really good to be here. Thank you for inviting me into the task force meeting. My name is Spencer Brown, and I am the member of the Arizona Commission of the Deaf and Hard of Hearing. My role is the communication and media specialist. So I will be taking on the role of making sure all of our information are blasted out on e-news, social media, or anything that we can get our attention and make sure that we spread the word, because my job is to empower your voice and help you empower your voice to the community. And I'm really excited to be here, and yeah, I'm really excited.
All right, well, we're excited to have you, Spencer. We're so happy that you're here, and I know you've already been such a huge asset to the team, and I know you come from way of ASU, which is really cool. And so welcome aboard, and thank you for taking a minute to say hello to us, and feel free to join us for the meeting or pop off. I know you're really busy too. So thanks for being here.
Thank you for having me here. I will definitely
Sure.
check it out and stick around.
Sure. Okay. And all right, I'm going to move on to our next agenda item. And what we have is just to review and approval of the minutes from November. So for any of you who are able to be present in our November meeting, if you've had an opportunity to review the minutes, if anybody has any suggestions for revision or corrections, or maybe a motion to approve. So feel free to turn on your camera if anybody wants to make a motion for that.
I move that we accept the minutes as written.
Thank you, Liz. So Liz had made a motion to accept the minutes as written. Would anybody like to second that motion? Okay, I know Barry, you were muted, and Ron had his hand up too. Oh, and Melanie has.
Oh, I will second the motion. Sorry, I was muted. You're right.
Okay, thank you, Barry. And Ron, did you have a comment?
Just to accept the motion.
Okay, great, thank you. And Melanie, did you have a comment?
No, again, just to accept, and it was a little slow on the video and the mic. So
Okay, great. All right, so we have our November minutes approved. So thank you. All right, and I'm just going to check. I know Nikki will be joining us, and I don't believe that she is here yet. Just want to make sure that I don't. Oh, yay, Nikki. Good morning. I wasn't sure if you were here yet. We're so happy to have you. I would just want to remind everybody that this is Nikki Sukup, and she is our Public Policy and Community Relations Director. So did I say that correctly, Nikki? Well, welcome. We're looking forward to having your report this morning. I'm gonna go ahead and let you take it away.
Hold. Nikki, you're muted. We can't hear you.
Hello. There we go. Okay. Hi. Today I am going to speak for myself. So if you're not able to understand, raise your hand and I'll repeat. I'm really happy to be here today. Thank you, Christy. And I'll give you all provide a lowdown on what the Public Policy and Community Engagement Unit has been doing for the last 3 months, I think, since we last saw each other. And it has been very busy. And we have a new governor, a new legislative session, new legislators, and ACDHH has not presented any new bill. What we are doing is we're watching all the bills that are being brought from the Capitol. And if there are any bills that affect the communities that we serve, then we will address at that time. So I will share a list of the bills, some of the bills that we've been tracking that I think you may be interested in. And but first, let me tell you a little bit about what we've been doing also as a public policy and community engagement unit. And so as you see, you've met Spencer Brown, and we have spent time in recruiting, interviewing, and selecting people for this position, and we are thrilled to have Spencer Brown with us. He has been a phenomenal addition to the team, and we look forward to more to come. We also, and then Michelle will talk about the work that we have been doing with the Age of Access project. And this is an Asian project that Sherry has been working on. And Michelle will share more about that in her report. We worked with the the Arizona Health Association, ACDHH, and creating a ASL film for their Advanced Care Directive. And this is all published on their website, and they've sent out a press release with this information. And we have made sure that the captioning is of quality. And I have to thank Michelle also for her eyes on that. And so that is on their website. And if you'd like more information about that, we'd be happy to share. And currently, because of that relationship with ACDHH, our CAU team, as a community affairs team, is providing further outreach and education with that group. I think there's been a lot. I'm going through my list of things. We also worked with the Arizona Broadcast Association to ensure quality caption at the Super Bowl, when the Super Bowl was broadcast, because in the past, we understand or know that the caption was off. It was terrible. And so what happened is that the local broadcast association did not turn off their automatic speech recognition technology. And even though there was human-generated captioning from the national network with beautiful caption, the ASR interfered. And so we provided education through the Arizona Broadcast Association to the local Fox affiliate TV station to ensure that they let this national caption come through. And the executive director of the Arizona Broadcast Association followed up along with us. We provided education information, and he made sure that each of the stations, they assured him that there will be engineers in the room the day of the Super Bowl to make sure everything was okay. And he even followed up with our team on Sunday. Is everything okay? And sure enough, it was. But if any of you in your communities, if you did not have that same experience that we had here in Phoenix, let us know. Because I'm not sure about Yuma and Tucson, but I know for us here in Phoenix, the captions were phenomenal, but perfect. Well, almost perfect. Never ever perfect, but perfect. But let's see what else. Okay. So those are just some of the things I wanted to touch on. And I think there's always so much more. Last December, I didn't do stress. I want to make sure I don't miss anything. Okay, but thank you, Michelle. She posted the video to ACDHH in the chat. Last December, I substituted for Sherry Khan, our executive director, on the Vulnerable Adult Board. I'm not saying that right. and the House Ad Hoc Committee on the Abuse and Neglect of Vulnerable Adults. And this committee is charged with making sure that the needs of vulnerable adults in group homes are being met. And so we presented a list of recommendations from ACDHH to make sure that the communication needs are not forgotten. And they took this information and it was shared in the public. And so it's a great opportunity to provide public commentary, even though this specific committee is the charge is very narrow. And they can only do so much, but we were able to present a broader recommendation on a public platform. And so that was appreciated, and I'd be happy to share our recommendations if you were interested in reading them. And then let's see. We filed a comment on the Administration for Community Living National Strategy to support family caregivers. And so that was presented, again, to make sure that the education and advocacy is there for those who work, with varying levels of hearing loss. And a lot of times you'll notice that in the rules or in the policies and procedures that they always, not always, but oftentimes forget about those with hearing needs. And so we made sure to put that information, hearing need, and we made sure to put that information in their rules and policies and procedures. Okay, so I will go ahead and I'll talk a little bit about the bills that are currently in the works. One of the things that I'm going to say this first is right now there are two bills. Let me back up, I'm organizing my thought. Okay, so first is there's a bill that will provide coverage of cochlear implant for those who are above age of 21. Currently, there's already ways for children to do it below the age of 21. But so this bill is moving through the House. Now, we have the Hearing Aid Association coalition that is waiting for this bill to go through. And then we plan to do hearing aid legislation in the same manner for next year. We are working with a university group as well as other, the American Speech Hearing Association, I keep saying American, Arizona Speech Hearing Association, and other related groups. And we are going to meet with legislators this April and start talking about the need for hearing aid coverage. But that is for next year. So next session, we will watch and plan for the hearing aid coverage to come through. Additionally, with the cochlear implant bill making it through is the speech therapy bill. And this is also, and this is very similar, that provides access to the healthcare containment system to cover speech therapy for all those who are over 21. So that's one of those. Okay. I'm going to go through some other bills here that you may be interested in. Let's see. As you know, you may not know, the Republicans passed a skinny budget and through the House and Senate, and they brought it to the governor's desk, and she vetoed it just the other day. So we expect some budget conversations to continue, and hopefully it won't be as long of a session as it was last year, but we will see. Let's see here. So there's some tax bills that are interesting. It's one for people with disability, total permanent disability. And property tax would be waived, would be exempted. Let's see. There's one for a veteran, but that one is kind of stalled in the House. Let's see. Representative Dunn has proposed a bill to appropriate $500,000 to the Department of Health Services to distribute to a nonprofit organization to implement a public education campaign on the awareness of Alzheimer's and dementia in rural and underserved areas in Arizona. And that one is stalled. It's in the House Appropriations right now, so we'll keep an eye on that. Gotta think something else here. Representative Longden has proposed a statewide ADA coordinator, and this is not a new attempt. She's tried this in past years, past session. But this time we're hoping that we'll be able to make it through. It's currently in the House government and we're waiting for it to be scheduled. There is a bill that is going through, has transmitted from the Senate to the House, and this is allowing a prescription for I can't pronounce it. Ophthalmic lenses, other than contact lenses, is valid for 2 years, otherwise specified by prescribing physician. Let's see. Senator Kavanaugh has proposed a probate advisory panel to establish this. And this panel will evaluate how to improve guardianship and conservatorship through statutory changes. There is another Senate bill from Senator Shope, and and this one is recently passed the Senate appropriation. And this requires ACDHH, the Department of Health Services, to address Alzheimer's disease and related forms of dementia by creating a state plan. And this state plan will assess the impact of Alzheimer's disease and dementia on Arizona, assess the existing state services that address the needs of persons who have Alzheimer's disease or dementia and their family caregivers, and provide a strategic plan for state action to increase access to care, support, and treatment, improve quality of care, advance risk reduction and early detection, and ensure a coordinated statewide response. And then the director is required to establish a dementia services program within ACDHH that meets a list of specified requirements, including facilitating the coordination and implementation of that plan. So this is, we look forward to this one also. So I'll be keeping an eye on that. And there's a good number. I plan to create a summary. This is it's been a busy year. So I'm looking forward to summarizing all the bills that we're watching, and we'll share a news release on that. Where is it there? That would be of interest. I don't want to take up too much time. So I think I've covered enough for now. There are some striker bills that we are watching. With the striker bill, they're the surprise bill that, they have the technical correction, they slide through, and then one of the senators or representatives, typically what we notice are they will take a new bill and replace it. So those are the surprise ones that we are watching. But also, because we don't know. But today is the last day for a bill to be heard in the same Senate, in the same committee. So if a bill in the House has not been heard by a House committee, it won't go through. And if a bill in the Senate has not been heard, it won't go through. So we'll watch for those bills that have died off. One of the bills that we know did not make it through required for open meeting, public meeting to be in person. And that bill never made it to committee. So we know that one's not going to happen. Okay. Representative Longden presented a bill to establish a nursing care institution advisory council and the Department of Health to advise on matters of oversight of nursing care institutions and issues concerning nursing care institution residents and their families. So this I imagine is similar to what the work they've been doing with the Vulnerable Adult Subcommittee. And within this, there is Representative Sang, who has introduced a bill on elder abuse and creating information pamphlet that requires all of the assisted living facilities to provide this information to the residents and their family. I'm going through my list. I'm tracking about 60 bills right now. Yeah, I think that's good. I don't know if there's anything else I may have missed. Longden has presented a bill similar to the speech therapy bill. They're similar, a little bit different, but the other speech therapy bill that SOAP is presented, that one is moving further than the one Longden had. Okay. There is a bill from Representative Hernandez, and she is requesting that they appropriate $2 million from the general fund to the Department of Economic Security, DES, to distribute to area agencies on aging for home and community-based services. So that money would go to the AAA agency. And that's on the House floor right now. Oh, World Hearing Day is on March 3rd. And Senator Leila Alston. She's done this every year, I understand. And she is recognizing, asking the members of the legislature to proclaim March 3rd as World Hearing Day in the state of Arizona, and encourage the citizens of Arizona to protect their hearing and seek the services of licensed hearing health care professionals for a regular hearing check. In this proclamation, she also recognized ACDHH for their work in this field. And I'm not sure exactly what we will be doing to recognize World Hearing Day. We for sure will promote this information through our emails and social media, but we may do something else. We'll keep you informed if we do. Okay. The appropriation budget. There's some talk on a lot of election related bill. But I think I'm good. Thank you.
Thank you so much, Nikki. It's incredible to have you here because there's so much of this information. I mean, obviously directly impacts our communities. So I just wondered if any of the task force members have any questions. Feel free to turn your camera on, or if you want to pop on and ask Nikki. Does anybody have any questions before we go on to the next agenda item?
Yeah.
Thank you, Nikki. It's so helpful. I'm
Thank
learning a
you.
lot from you and I appreciate it.
Absolutely. Yeah.
Thank you.
Bye-bye.
Okay, everyone. Let me see here. Next on the agenda, I have the Hard of Hearing Specialist report. So that's me. And I just want to take a few moments to tell you about some of the things that I've been working on. And you all know here, being our wonderful leaders in Arizona for the Hard of Hearing, we have more than 1.1 million people in our state that are hard of hearing or have some varying levels of hearing loss. So since we last met in November in this quarter, I've had more than 620 emails or phone calls from people across our state who are basically looking for a number of things. They're reaching out to me because they cannot afford hearing aids. They have questions about accommodations and how to self-advocate. They may be looking for emotional support. They may be new to hearing loss and not sure what to do. Many people reach out to me. They're navigating employment. They have questions about assistive technology, communication strategies. How do they access information in doctor appointments? Or how do they go to an entertainment venue and have access to the wonderful things that we have available here in Arizona, the wonderful everything across the state that we have. And so people reach out to me for all different things. And it's really important. The reason I share this number is because we do track this information, and then it's helpful for us to be able to show how many people out there are really looking for assistance. We still continue to have our Hearing Healthcare Assistance Project with ASU, and this is our program where we assist people who are low income and cannot afford hearing aids. We have at this point in time referred 50 individuals to ASU, Speech and Hearing Clinic, for hearing aids. For people, when they do reach out, I ask a lot of information to see if they qualify to apply for that program. And if they don't, possibly there's other resources. They may go to vocational rehab, Veterans Administration, some people even contact me not realizing that they have coverage with their Medicare Advantage plan. So there's a lot of different things that I work to gather from that person and try to figure out what's the best resource and the best fit for them. And one thing that we're really excited about is, I know we're switching interpreters here, so let me give you a moment to change over. Y'all set? Okay. We're really excited because we have now, as of January 1st, we've expanded the Hearing Healthcare Assistance Project north to NAU, to Northern Arizona University, so we can reach folks up north. And that's really exciting. So we'll be having even more people to be able to refer to that program. So I'm excited about that. Let's see. Please feel free to send anyone my way if they're having concerns about affording hearing aids. As we all know, they're so expensive, and people have any type of question relating to that. Don't hesitate to share my email. Let's see. Another big part of my job at the commission is outreach and education. And just a quick note on that. Kim Menard, who's our deaf specialist, and myself, we continue to provide we call it the Communication Access Resources for Empowerment, or our CARE training. We provide this anywhere in Arizona. We'll travel. We go across the state with our team of interpreters and CART. We provide CART, and we train healthcare professionals in hopes to help them gain awareness and insight and how to provide access to all of these people that are coming to them for appointments and are not maybe able to understand. And if you think about it, the numbers, once we're in our 60s, it edges up to 35% of people. And once we're in our 70s, half of people who are going to medical appointments are struggling to understand, especially when people have masks on. So that's a real challenge right now for us. And we want to figure out what we can do to let people gain that access and have, effective communication. We also have our Let's Get to Work for employers. That's another presentation that we provide across the state to any employers hoping to help them gain understanding of our superpowers as hard of hearing people and what we would bring to the table to different employers, and all of the many reasons why we are great employees and what we can bring and helping them to just gain an understanding of what they need to do to make things accessible on the work site. And we continue to provide our peace officers standards and training, or the AZ post, for first responders and police officers. So we're doing all we can to educate as many people as possible and just get the word out. I want to say another exciting thing. When I was at the Walk for Hearing this past fall, I touched base with many of you know Dana Leonardo of Gilbert Public Schools. We kind of crossed paths at the Walk for Hearing. And so we were talking about how awesome it would be if ACDHH could go to the schools and present to the kids. And so we have an assembly planned pretty soon. We're going to be meeting with more than 500 kiddos to help them learn about the deaf and the hard of hearing. So I'm really excited about that. I wanted to just share quickly. The HLAA, which is the Hearing Loss Association of America. We have two chapters in Arizona, the Sun Lakes chapter and the West Valley chapter. So just a note on whenever I'm available, I really want to attend those meetings. Sometimes I present at the meetings. Personally and professionally, these meetings are so crucial and helpful. So for anybody that's watching from the public, I hope that you'll be able to attend one of these meetings. I think one of the most helpful things for hard of hearing people is to connect with other hard of hearing people. So we really are grateful for those chapters, and also our chapter in Tucson, Aloha. So we're going to hear from those leaders soon. And we just have a lot of trainings that we have coming up. It's been, like Nikki said, it's been very busy. I want to just mention a hold the date in April 21st coming up. We've been working with the Ballet Arizona. So April 21st in the evening, there's a theater here in Phoenix, the Dorian Theater on Washington Street. We provided a training for them to make sure that they would have access, cart captioning, loops, and ASL interpreters for a presentation coming, for a show coming up in April, because entertainment's so important and we have every right to have access just like everyone else. So that's coming up too. Let's see, what else? I think that's about all I have that I wanted to share for my report. And does anybody have any questions? No? Okay, great. Well, let's see, what time do we have? It's about 10 of 10. So I think I'm going to ask Michelle. I know one of our task force members, Cynthia, has to leave early. Michelle, do you feel that you would like to give your report first, or should we have Cynthia go first? I know you have some things to cover.
Yeah, I can go ahead and go because I only have just a couple things. So it's only going to take a few minutes.
Okay, great.
Yeah, it's going to be pretty brief because
Okay.
You covered a lot. Yeah.
All right, Cynthia, we'll let you go right after Michelle.
Okay.
Okay, great. I'll let you take it away.
First of all, I wanted to say that people at the Aloha and the Aloha members have been going to performances at the Community Performing Arts Center in Green Valley, which has a wonderful loop system. And I saw Murder on the Orient Express, and one of our members was in the cast. So that was a lot of fun. And we have just discovered this, and it's not very far away. Another thing is, one of the things I do in my job as president of the board of the Adult Loss of Hearing Association is to supervise our office manager and our current office manager. With our current office manager, it is such a pleasure to do that. She finds everything in the computer. She has excellent QuickBooks skills. She's just more skilled than any person we've had in the office so far. And she discovered, I had her find the amount of donations we got in 2022. And we were, with our mouths open, we brought in about $50,000. So we've been very lucky. And this is the first time we've even known how much is coming in. And Tish is keeping an eye on it. All right, another thing I wanted to say was that we have lined up our speakers for the spring season. We had a video that you would all be interested in probably by Jim Hudspeth. And the name of the video is The Beautiful, Mysterious Science of How We Hear. It is a TED Talk. So everybody can find it on YouTube. All right. In February, we're having Kaylee Boyles, who is our who is our University of Arizona liaison person to our board. And she has set up a program where we go and speak with the University of Arizona students. We're going to have our second one in March 1st. And she herself is going to be one of our speakers in February and tell us about what is the life of a U of A doctoral student in audiology like. So we're looking forward to hearing that. Also, James Rowe is coming to talk with us and to help us possibly with our loop verification project, if any kinks are found in it while we start up again. That's about all I have. Thank you so much.
Thank you, Cynthia. I appreciate that. Does anyone have any questions for Cynthia? And I'm looking forward to coming to see you too. And aloha, Cynthia. Looking forward to that very soon.
We are too.
Yeah. So I'll be seeing you soon, and we'll go ahead then and turn it over to Michelle. Thank you.
Okay, hi. Yeah, I'll just take a few minutes here. I just want to stress again the project that we're calling Age of Access, aging adults who are deaf, hard of hearing, deaf, blind. And as we age, accessibility is so very, very important. So we have on March 25th, Saturday, we have our first ever Senior Healthy Living Expo, and it's free. It's from 9 a.m. to 1 p.m. at Ability 360. There is an Eventbrite place where you can sign up so we know how many people are coming. And we have a keynote speaker, and he's going to be talking about dementia and the deaf and hard of hearing. He's flying in from Washington, an esteemed doctor. And we're going to have a lot of vendors, and it's going to be focused on older adults who are deaf, hard of hearing, deaf, blind. This has never been done before in Arizona. A lot of times you have those big expos and there's tons of people and you can't hear. We're going to have CART. We're going to have sign language interpreters. We're going to have a lot of access at our event on Saturday, March 25th. So I want to make sure you know about that. The other thing is with the Age of Access is we're going to be unveiling at that point a new website. It's called Age of Access, and it's a simple to use website for older adults who are deaf, hard of hearing, deaf, blind. So we're building that out, and we'll be adding in resources that are, again, very easy to find, very easy to click, nothing too overwhelming. So the Age of Access website will be kicking off at the end of March. So those are some great things we're looking forward to. The other thing that we're really focused on is caregiving. If you've ever been ill or sick or been in the hospital, somebody help take care of you. And if your husband, wife, partner, best friend, whomever has ever been ill or sick in the hospital, you've probably given some care to them. When it comes to caregivers, most are family caregivers. Most caregiving is done by family and friends. There are professional caregivers. They are also called direct care workers. And so they have state certifications. But most caregiving is provided by family and friends. So caregiving is an area that we've been looking at as to, if you're receiving professional caregiving, are you receiving the communication access that you need? For deaf people, are the caregivers culturally aware of sign language and deaf culture and that kind of thing? So we are working in coalition with other organizations, one of them being the Arizona Caregiver Coalition. Now, the Arizona Caregiver Coalition, and I'm going to just put it in chat here. The Arizona Caregiver Coalition, I remember when it was just an idea. There was a beautiful, beautiful man named David Best, B-E-S-S-T. And David was working for the Department of Economic Security, and he was caring for his mother. And he would go to the Governor's Advisory Council on Aging meetings and talk about the demands on him as working full-time with the state and caregiving of his mother. And so David just kept sounding the horn that we needed caregiving support. And from his efforts came the Arizona Caregiver Coalition. It's a wonderful organization. And from there it became the Arizona Caregiver Day at the Capitol, where family caregivers go down to the Capitol, have lunch together, learn about the caregiving issues, go out and talk to the legislators. And so there have been some really great advances. For instance, legislators in previous years have passed credits for people who they can actually get money to support that home caregiving. And so there's different benefits like that have come about. And so the Arizona Caregiver Coalition, and I put it in chat, it's also azcaregiver.org. And they're having two events here. One is March 9th, and it's online. And we will be providing CART and interpreters, our agency. And then there's an actual event at the Capitol on April 6th. So that's in person. I've been to that many times. And we will also be providing CART and ASL interpreters at that. And we'll have a booth too. So if you are interested in caregiving, involved in caregiving, I would encourage you to make your presence known because it's very important that they hear from us, deaf and hard of hearing community members, what we need. So another thing that we're doing with our Age of Access project is we're working with Gallaudet University, which is the only university for the deaf here in the United States, the first and oldest. And Gallaudet is working with us on developing a survey for deaf and hard of hearing, deaf-blind folks to take, asking specific questions about what their needs are. So that survey is going to come out pretty soon, and you'll be hearing about that, and we'll be sending it to you and encourage you to fill it out because, we need to know, what do you need? What are your issues? What barriers do you have? And how can we work? How can Nikki work down at the legislature to motivate the legislators to take action on issues affecting deaf and hard of hearing? So we need to know from you about that. And then the other thing I mentioned again was March 25th. March 25th is our senior expo. So please do sign up for that. Come out to that. It's going to be a lot of fun. And it's a beautiful time of year. And it's right before my birthday. So come celebrate. That's all I have for now. If anybody has any questions for me, please turn on your camera. And Ron Tallman, Mr. Ron. Hey, guy.
Hi, Michelle. Thank you for the update. I received your email a couple of days ago about the March 25th with a link for registration. If an individual does go and they did not register, can they still get in?
Yeah. That just gives us an idea of, we want to have refreshments. So gives us an idea.
Just to let you know that Mel and I, or the West Valley and Sun Lakes chapter, are going to share a table out there. I'm going to do the first 2 hours, and West Valley is going to do the second 2 hours.
Wonderful.
Yeah, we're looking forward to it. Thank you.
You're welcome. Okay, no other questions. I will turn off my video, turn this back over to Christy.
Thank you, Michelle. Okay, it's just a couple minutes after 10, so it's really important that we give our interpreters and CART a little break. And why don't we come back in 8 minutes at 10:10. So we'll see everyone back at 10 after 10. Okay, and we're going to go ahead and go on a break, and we'll thank you, Anne-Marie, for sharing the break sign. We'll see everybody in a few minutes. 10:10. Okay, Anne Marie, thank you for sharing that sign. And it's 10 after 10, so welcome back to the Hard of Hearing Task Force meeting. Just want to pull up my agenda here. Okay, the next item that I have on our agenda, which we just like to kind of have here as a checkpoint, is over-the-counter hearing aids. And I just wanted to share quickly. We all know, and just again, we have these meetings live streamed to YouTube, so hopefully this information will be helpful to the public. But we all know as of October, the Food and Drug Administration rules now allow the sale of over-the-counter hearing aids. And especially we're wanting to alert our senior community just to make sure that they're clear on what that means, and that why consumers should be really careful to understand the difference between the over-the-counter hearing aids and hearing aids. We want to make sure that everyone knows that the hearing aids are not intended for anyone under the age of 18, and that these over-the-counter hearing aids are for adults who have perceived mild to moderate hearing loss. And just to be mindful, we want to make sure people have, read the box or read what you're getting to make sure there's a refund period, that there's a money back guarantee, to compare prices, because we can see anything out there from several hundred to several $1,000s for hearing aids. Read reviews on the hearing aids, and get some expert advice. You can definitely go to an audiologist and ask, have your hearing tested, have your ears looked at, because that's really important that you understand what's going on, and if this is something that would be an option. And I just want to throw it out there to the rest of the task force members. Does anybody have any comments? Has anybody seen anything or been aware of anything in your area regarding the over-the-counter hearing aids? Just kind of opening the floor. Hi, Liz.
Hi. Yeah, just a couple of comments. I did want to share that our Sun Lakes East Valley HLAA chapter had Dr. Ingrid McBride speak last month, I guess it was, to our chapter meeting. And a good part of her presentation dealt with over-the-counter hearing aid access. It was excellent. And I think what it showed us was that we really need to educate adults about what it means. She did touch on different hearing aids, as you said, the different prices, and also reiterated what you said, that we need to have our ears looked at to make sure nothing else is going on. But it's so important that people understand what over-the-counter hearing aids represent and what they are to do. We also have quite a bit of interest here in the Sun Lakes area. It is a senior or an over 55 adult group here, and I have had the good fortune to do a couple of presentations, and people are very interested, but they are also cautioned to make sure they take it slow and fit the parameters. So I think education is really important. I think it's a true boon for people to enter the hearing aid world if they have been reluctant because of costs, etc. But people need to know just what it's all about, as you said.
Thank you so much, Liz. Ron?
Just a short comment. Thank you, Liz. I was going to talk about that, but it's
Okay.
always, it just got out there. One more item, working with the HLAA national organization, we're getting copies of over-the-counter hearing aid checklists so that you'll be able to look at what is best and better or best. And I will have those checklists available at the March 25th event that's going to take place.
That's wonderful. And I know we're going to be switching interpreters. Wait. All set? Yeah, these are all it's just important, such important points. And that's why we bring it up and hope if anybody does find us on YouTube and they're able to watch our meeting, that they'll gain some insight and understanding. And does anybody else have anything they want to add as far as over-the-counter hearing aids agenda item? Okay, thank you for that helpful feedback, Ron and Liz. Okay, what I'd like to do next is we have our Hearing Loss Association of America, or HLAA chapter leadership announcements. And I'd like to start with Melanie, Commissioner Melanie O'Rourke from our West Valley HLAA chapter. And I'm going to turn it over to you, Melanie.
Oh, there we go. Okay, thank you, Christy. We have continued to have in-person meetings, and we're having obviously a smaller attendance. So we're going to be trying to come up with some plans to see what we can do about increasing attendance in the West Valley. With that being said, we actually did have a great turnout for the special event that we had January 31st when Lou Ferrigno came. He's a recent cochlear implant recipient. And so there was a lot of interest for that and a great turnout to hear that information. And 2 weeks ago, or 2 days ago, rather, we had a presentation from Sherry Collins. And so we had a little preview for all our members to see what is going on with the Arizona Commission for the Deaf and Hard of Hearing. And I think the best part is and Christy was there also, it's letting these members see a person. When I talk about these announcements at the meeting, it's just means so much more when they actually see a person come. So that was a great presentation. Our next couple of meetings are going to focus on accessibility with the loop, and we're going to have Lou Touche, who used to be in Tucson, I'm pretty sure. Now he's up in Washington State. So that's going to be a Zoom presentation, but we're still not moving back into hybrid meetings because we're having some issues with Zoom. But we keep on working in that area, and there's a presentation coming up at the end of February, an HLAA webinar that is talking about all things hybrid, and so our board members plan to attend that. Let's see. We also are obviously encouraging members to attend the National HLAA, and we do have 3/4 of our board has signed up to attend already. So I, as you know, who obviously has been doing a lot of caregiving, as Michelle mentioned earlier, am still on the fence. So I'm not quite sure if I'll be attending, but our other board members were. And then just lastly, I received a phone call from a Lions member. I'm not quite exactly sure what his position was, but he was calling because he had a huge quantity of hearing aid and hearing aid equipment, and he was wondering what to do with it. And I said, I know just the place. And so I got in touch with Christy, and I got the information to send it to ASU, and then I passed it on to him. So hopefully he followed up with that. And they are now having a great supply of used hearing aids and other hearing health equipment. We continue to have our Zoom book club meeting every 2 weeks. Fred Williams is running that, and we get again a varied turnout depending on where it's at. We're reading right now Hearing Loss for Dummies, and we're enjoying it. Always learning new information. So I think that's it.
Thank you, Melanie. Does anybody have any comments or questions for Melanie? Okay, great. It's always great to be at your meetings, as I said, Melanie, and I know Sherry and I really enjoyed being there with you last week. So thank you.
Thank you for taking the time and coming. It was great.
Yeah.
This is great.
Thank you. All right. I think now I will move on and turn it over to Ron Tallman for the Sun Lakes chapter. And Ron, if you want to take it away for the Walk for Hearing after that too, for any updates.
All right, thank you, Christy. Our chapter meeting has been growing very steadily since we started going back to in-person meetings back in October. We had in February, Dr. Susan Schmidt came out, and she's from Arizona Balance and Hearing, and she gave a very great presentation on tinnitus, and we had just about 54 people attend that meeting. It was standing room only, it seemed like, but it was a very good crowd, entertaining with lots of interaction between Dr. Schmidt and our attendees. Next month, we are looking at having Dr. Tabitha Buck from A.T. Still University, who is going to give a presentation on autotoxic drugs. And so we're hoping for a good turnout for that. We're still kind of up in the air what our May meeting is going to look like. We're talking about showing the movie that HLAA National put out called We Hear You, Now Hear Us. But the board will meet on that next month, and we'll discuss what May is going to look like. We have gone to completely off-site CART. As Melanie has said, and probably agrees, is that having off-site anything is challenging. The technology here works when all the stars are aligned in one place, and but it comes with its challenges. Hope is still meeting. We meet in a virtual setting. Our next Hope meeting will be February 23rd, and we meet at 10 o'clock or 10 o'clock in the morning on the fourth Thursday of every month. Just to let everybody know, the National HLAA Convention has been announced and registration is open for that. It's going to run from June 28th and through July 2nd, I believe. And I have registered to go, so hope we get more people from Arizona this time. Okay, I'll move into the Arizona Walk for Hearing. Will be held here in the same place, Riverview Park, on November 4th, 2023. The 2022 walk concluded and raised just over $46,000. And of a significant note, and I like to share this because I think it's, people ask what happens to the money. Well, $13,900 was raised through the Alliance program. And that is for those individuals who have an alliance developed from Arizona. So $13,900 remains here in Arizona from the National Organization of the Arizona Walk for Hearing. So it's nice to be able to share that we are raising money for the hearing loss organizations here in Arizona. And just a few of those alliances with Gilbert Public Schools, Diamond Dogs, the Arizona, there's quite a few. And so it's nice to see that the funds are staying here. I believe that's all I have. So if anyone has any questions, let me know.
Thank you, Ron. Okay, it doesn't look like there's any questions yet. I know Cynthia has already shared her information earlier, so we'll move on to our next agenda item, which is employment, and we're happy to have Harvey Smith with us. And Harvey, I'm going to turn it over to you.
Okay, thank you. Can you hear me? All right. Can everybody hear me?
Yes, I can hear you.
Yes.
Harvey. You sound good.
Mhm. Yes.
Okay, thank you for that. So the job market is still doing some very strange things. We're seeing a lot of businesses really focusing on diversity and inclusion. And it's amazing how many of them forget that there are so many wonderful, competent, interesting, fun, friendly, productive persons with disabilities who really should be working on their teams. So I'm getting a lot of chat about that, which is lovely. I am starting to see some layoffs in IT, and then a few other areas we're starting to see layoffs. That being said, unemployment is still at record low levels. Numbers of job postings as of this morning in Arizona on our statewide job board is about 106,000 posted jobs. So I know I've been saying this for quite a while, but never really been a better time to look for a job or look for a new career. So if somebody is interested in changing, that would be great. This week, Maricopa County had a career fair, which was at Chase Field on Wednesday. We had 2,300 job seekers show up, which is great because Maricopa County needs to hire on average 200 people every month just to stay level. But we have about 13,500 employees. We should have close to 15,000. And the need is only going to increase because people keep moving here. We've got lots of families moving from California, Chicago, especially Chicago this time of year. I think it might have something to do with the weather. And Texas are the three states where we're picking up a lot of people. So as an employer, we're always looking for good people. And it was a lot of fun. The career fair had just about everybody, including Baxter, the Diamondbacks mascot. We also had the World Series trophy at the stadium, so you could come and see that and take a picture of that. But perhaps most unusually, this was a career fair where our friends from the Superior Court were officiating weddings. And we thought, oh, this would be cute. We'll have a few people come in and get married at the ballpark. Well, we thought we would have one or two couples. We had nearly 100 couples show up to get married at the ballpark, which was lovely. And it really made for a festive time. The other thing we did was we had animal care and control adopt out dogs and cats. So you could come and have a look for a job, get married, pick up a puppy. Oh, and public health were there. They were doing vaccines. So we joked that you could come to our career fair, pick up a new job, get married to your significant other, get your vaccines up to date, and go home with a puppy. So it was a huge amount of fun. It's an event that we're looking forward to doing again. We're already in planning perhaps for March 2024. So I hope next time we meet, I'll have a positive report about the number of people we actually hired. A lot of job seekers forget about careers in local government. And I would encourage people not to make that mistake because I can speak from personal experience that government is a good employer and the people are wonderful. So that's really my report for labour market. I am getting a lot of curiosity, as I said, from businesses about diversity and inclusion, including persons with disabilities. So I've been leaning on Michelle and Christy quite a bit. So I want to give them a shout out for their support and help over the last couple of months. So if you are looking for work or you're looking to hire somebody, drop me a line. Thank you.
Thank you, Harvey. That sounds like an incredible event. I love that. All the things happening with the weddings and adopting a puppy and a vaccine, that I would think that that would have really drawn in a lot of people. The number that you threw out, I think 106,000 positions open in the state. That's just almost unimaginable. And I just had a question, and please, if anyone else has questions, feel free to turn your cameras on. Are those positions, Harvey, what is your sense, are some of them virtual? Are some of the positions virtual? And then do they span every level as far as education? And I'm just more curious about that.
So great question, Christy. Yes, the jobs do cover everything. So whether you have a teenager still sleeping in your basement and you would like them to have their first job, or whether you have a PhD and you are looking to leverage that experience in education, all the jobs that are there. The one sector that is truly competitive is the work from home jobs. It seems to me that everybody likes the idea of working from home, except for the employers, because most of them have learned that working remotely part-time works, but the rest of the time you need to be in with the team to build those soft skills, to build those relationships. If I had $1 for every time a job seeker came to me and said, oh, I'm only interested in a work from home job, I'll be buying all of us lunch for the rest of the year, because a lot of people think they would like that. And I understand if you have childcare issues or transportation issues, working from home is very, very attractive. What people forget is that managers are more intentional about tracking your performance if you're working from home. So for example, we have worked with job seekers who worked at Amazon. They were in customer service when all of their jobs were sent home. They thought, this is great, I can just do my work from home, not realizing that every time they touch the keyboard is being tracked by management. And management are looking for so many keystrokes per hour. And if they don't see any for a couple of minutes, then they will red flag it. So the people I've met who are working from home have said, I'm actually working harder sitting at my coffee table than I did when I was in the office. So just a gentle reality check that work from home jobs are, for the right person, a wonderful thing, but they're not really for everybody, despite how we might like not commuting and showing up for work in our pajamas.
Great. Very, very interesting. I was curious about that. Thanks, Harvey. Does anybody else have any questions for Harvey regarding employment?
I have one thing to share. We are seeing serious increases in wages across the board. And partly that's because of places like Starbucks and Dutch Brothers, where they're paying $20 an hour plus benefits day one, which makes it really hard for those positions where they're paying $15 an hour to compete. So that's something that is it's kind of fun when I sit down with the job seeker and I say, oh, by the way, you should be asking for 25, 30% more than perhaps the number you had in your head. That's pretty fun. The bad news is I have the opposite conversation with the business owner, and they really don't like me saying, hey, you're not paying enough. That's why you're not getting any candidates. But for the job seeker, it's a good time to be looking. And most of the job seekers I'm seeing once or twice, and then they land the job. So I don't get to spend much time with them, and that's a good thing.
Thank you. I know another thing, being on a call recently last week, how this all impacts, we talked about caregivers, and so many of our caregivers are family and friends, but of course we also need those employed caregivers, and unfortunately many of them not having the pay that maybe they would like. This impacts that field and in the amount of caregivers that are available also.
So caregivers is part of the healthcare sector that I work in, and caregivers are at a real point of crisis. You're absolutely right. None of them make enough money for the work they do for our family members or even us. And unfortunately, a lot of them are federally refunded. So there's no cushion for increase in pay because they're federally funded. So those positions are really being squeezed. Why would you take 14, 15 an hour with limited benefits and an unknown schedule when I can go to Starbucks and make $6 an hour more and have benefits from day one, and they will pay for me to go to ASU? It's a real crisis, and I don't see it getting any better anytime soon. So I'm looking forward to the fact that we are looking at that, especially for caregivers who are gifted with the deaf and hard of hearing. That is a niche within a shrinking job market. So the crisis is very real, and I'm very pleased that as an organization, you're looking at it.
Yeah, so something so important for us all to keep in mind for sure. Thank you so much, Harvey. We always appreciate your input. Okay, the other, or I should say the next item on our agenda, we have captioning advocacy and efforts, and I'd like to just open this up across the table for all of you. I know one of the things I'm getting a lot of calls on too, especially, and one are for people who are going to doctor appointments and not realizing that they can request CART or how to even maybe use or try their smartphone to use automatic speech recognition. But here we're really thinking about, I know Nikki gave us some great input on captioning, for example, for the Super Bowl, but I'm just wondering if you're getting any feedback from your communities on regarding captioning and entertainment venues or medical appointments. So just wanted to open the floor and we can talk about this and see if anybody has any comments. No questions? No? Well, it's something that we'll definitely keep a watch on. It's something that's, as far as being hard of hearing, I think it really is the best kept secret. CART is the best kept secret. So often I do more and more when I go to medical appointments, I request CART, and I have had interpreters show up. Unfortunately, even when I explain what CART is, there's a misunderstanding and how CART and captioning gives equal access and effective communication to those of us who are hard of hearing. So Melanie, you have a comment?
I do. I was just going to say, Christy, I've been to obviously a lot of medical appointments this past year, and I do use Otter quite a bit. And you know, I've never gotten any negative comments from the providers about it being used. I have requested captioning with a support group that I joined. It then was not appropriate actually for me, so I never went back to see if they were continuing with the CART services or not. So I guess that's kind of on me. I didn't follow up with advocating for CART for that meeting, but I guess I tend to rely on the apps that I use. And that's, you know, just sometimes it's a word that just didn't come out quite right. And, you know, the provider is talking away and you wanted to just catch that word. So I actually share that with a lot of people, you know, that's available, the apps.
Great. Thank you, Melanie. But if any of you do have any of your community members reach out to you in regards to captioning, even on the television, that maybe aren't accurate or anything at all relating to captioning, please don't hesitate to reach out to us. And you know, we're always happy to get those calls and figure out what we can do in regards to that. Did you have oh, Melanie, did you have something else? No, okay. Okay. It's just it's okay. Let's see. So that's just an important, something that I want to keep on our agenda for everyone to keep in mind, to keep a watch out for any challenges out there as far as, because that, again, that's what gives us equal access and effective communication when we have captioning. And so when we request it, we're paving the way for the next person, because it really is the best kept secret. A lot of times, unfortunately, whether it be an entertainment venue or a medical professional, they're not aware that that is something that we have the right to request. So we're our own best teachers and our own best advocates. So please keep a watch out for that and let us know if you have any questions or comments on that. And if there's any other, and we have another agenda item for announcements or just general information, does anybody else have anything that they would like to share or comment on? Okay, I'm not seeing anybody turning on their camera, but I'm grateful for all of you and all that you do for our hard of hearing community, and we hope you won't hesitate to send folks our way if they need any information or resources regarding hearing loss and navigating being hard of hearing. That's what we're here for at the Commission. So our next meeting date is May 19th. It certainly will be a lot warmer. It's been a chilly winter. I'm not complaining, but it's been kind of cold. But if anybody, no other questions, I think everybody's has not turned on their camera, so I think we're good to wrap it up. It's 10:43 a.m. And I think I'm just going to say thank you for joining us today, and we appreciate you. And thanks to our CART provider, I'll be putting together some wonderful minutes, and I will be sending those off to you shortly. And I hope you all have a wonderful, wonderful weekend. And again, appreciate all that you do. Thank you, everybody. Bye-bye.